Hi, this is Ming, the injury guru. I am a physical therapist here in New York City, and I am the author of the book, The Permanent Pain Cure. It's a how-to book on how to cure your aches and pains in your body. Today, I want to talk about these players in the NBA, and they're having a whole spate of injuries, specifically Kawhi Leonard, presently with the Toronto Raptors. If you remember, about a year or two ago, he had a pretty serious knee problem, and he had a conflict with the medical staff at the Spurs, which eventually led to Kawhi Leonard asking for a trade. He demanded to be traded because the medical staff felt that he was able to play, but Kawhi Leonard said that there was still a lot of pain in his left knee and he was unable to play. If you know anything about Kawhi Leonard, he's probably one of the best players in the NBA, certainly top two, if not the best. And he's certainly the best two-way player in the NBA, meaning he plays offense as well as defense at very, very high levels. So he does not have a profile of a person that will try to, fake an injury or prolong the amount of rest that he would get as a result of an injury. So he's just a very hard-working young man, and I know people that know him, and he's a gym rat, and he's a hard-working guy, and you can see through his work ethic and how much he's gotten better over the past few years. So the question remains: what happened? Why did Kawhi Leonard feel that he was mismanaged, and it led to the point of acrimony and then eventually a trade from the San Antonio Spurs to the Toronto Raptors? He was told that he had tendonitis, or he eventually turned into tendinosis, which is a slightly different situation where there's not as much swelling, but it's essentially the same thing. And to me, it probably was a soft tissue injury. And the reason why, this is just conjecture now, I was not there, but I have had patients that had similar situations where he might have had a quad problem that led to a lot of tightness that was pulling on his tendon, and eventually the tendon got inflamed and it got to the point of tendinosis. The problem here is that if you took an MRI or an X-ray of the knee, it's not going to show up because it's a soft tissue injury. Scar tissue and adhesions don't show up on X-rays. So how does one detect if a person has scar tissue or adhesions, say, in and around the knee joint? It's actually very simple. It's your hands. You have to have great palpatory skills. Palpatory skills meaning that you're using your fingers as a tool for diagnosing a patient's injuries. I've had many patients here in New York that have really, they sadly told me that the doctor literally didn't even touch the knee or whatever area that they were being examined for, and they just relied on the MRI, which I think is a really, it's an incomplete way of diagnosing a person's injury without doing palpation or using your hands to figure out what the problem is. It would appear to me that Kawhi Leonard, and I read this in the past when he was with the San Antonio Spurs, had a contusion of the quad, which to me gives me a hint that could have led to the problem in his patella tendon, which led to the knee problem that lingered on for basically the entire year. He was out for the entire year, in effect, and which led to the acrimony between the Spurs and Kawhi, and he eventually left. So the point here is that if you are not properly examined, I believe that using really a highly skilled person that has good palpatory skills to help diagnose along with the MRI, that will give you a much better picture. But if you just rely on the MRI, the doctors are going to miss a lot of important information that they could have had. As an aside, if you look at more recently, if you look at Kevin Durant of the Golden State Warriors and also his teammate Andre Iguodala, they both suffered pulled calves. They were just doing their thing. It wasn't any contact. They just went up, they came down. and they both, their calves had seized up, and now they're both injured. Iguodala played, but you can see that he was hurt. Kevin Durant has not played for 3 weeks. And once again, how does one prevent this? If I'm the owner of a team, I would be very alarmed to figure out why my star players are getting injured and why it's not being prevented. It's a worrisome thing, given that these teams pay these people $30-35 million a year to play, so they really need the services of the ball players. And once again, as I said a minute ago, if you have a competent soft tissue therapist or a doctor that is able to palpate, let's say, the calves or the underside of the foot, or even the hamstring, what I call the posterior chain, the posterior kinetic chain, if that area is tight, you're going to have tightness in the calves. So all you have to do is just land hard and that whole thing will tear. And apparently that's what happened to Kevin Durant and his teammate Andre Iguodala. So the lesson here is that you cannot just rely on using MRIs to cure or to diagnose an injury or an injury in the making. You have to have people constantly evaluating the quality of the myofascial tissue in the ball players. Now that's just professional athletes, but you get people who are normal people, they have the exact same thing. If you have poor quality connective tissue and you don't have a doctor or a therapist that has good hands and good palpatory skills, that injury is something that can really plague you or create a massive problem down the road. So for you folks out there, I suggest if you're feeling not 100% and there's something wrong, like you feel there's tightness in your body, that can absolutely lead to a major catastrophic injury in the future. So please refer back to some of my videos. I always tell people to make sure you keep your fascia nice and healthy, the fascia being the connective tissue, by hydrating properly, taking the right supplements, getting regular massage, which is deep tissue massage, and especially getting myofascial treatments at least once every 6 weeks if you're over 40, to keep the tissue honest. I believe strongly that if these players are getting the proper nutrition, hydration, and myofascial treatments, these calf pulls or these knee injuries that are occurring in apparently great numbers, particularly in the playoffs these days, could be avoided. So that was my message for today. I hope you keep your fascia nice and healthy, because in the long run, it will prevent catastrophic injuries that may need not happen. So get yourself a qualified therapist or a qualified doctor that has great manual skills that can blend using MRIs and their hands as tools of diagnosis. This is Ming Chu, the injury guru, and signing off. You can take a look at my website at mingmethod.com. If you want personalized service, or you want to come in for a treatment as a patient of mine, feel free to contact me. Watch the game. It's on Wednesday night, and I'm looking forward to the game. I'm a big basketball fan. And stay healthy, keep your connective tissue nice and supple, and you will thank yourself, and you will have your body thank you for an injury-free body. Good luck.